Mission welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala, and Dr. Richard Jensen, who is also a board-certified acupuncturist, practiced independently in Shoreview, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Wonderful to have you with us on this dimension of House Call. It's always great to come into your home or wherever you might be, and many of you watching us on DVD and many listening to us through your computer and on CDs of the oral recordings of the programs. We're going to talk about headaches today, and of course there are millions of people who suffer needlessly with headaches. And as doctors of chiropractic, we're not going to treat brain tumors and aneurysms in the brain or things that we'd need a surgical intervention, but we do have some interesting dimensions from a natural perspective for those who are suffering with headaches and or those who want to have a life free of headaches. So, millions of people do suffer needlessly for headaches. Millions are taking drugs that don't help, that don't cure, and probably never will either. Many have long-term adverse effects that are cumulative effects of taking medications. Some people are treating the symptoms and not the cause. Some are even going to chiropractors, massage therapists, and nutritionists for treatment of headaches, and it's not helping them, it's not curing them because the cure might be from a natural perspective, but they may be missing the boat in that they have a tunnel vision approach to the treatment of headaches. So what are some of the possible causes of headaches? Certainly brain issues. We want to rule those out, and hopefully if you're going to a doctor or chiropractic and you're complaining of headaches, that they're doing a neurological workup on you as well as a orthopedic and physical and postural workup on you. Another dimension of the cause of headaches are food allergies. Many people don't realize that, and we're going to discuss that in more detail in the program. And of course, as I've already related to, many of the people who suffer needlessly with headaches have spinal issues that are not being addressed at all or are being addressed incorrectly. So, possible brain issues, certainly we want to make sure that we have a good history. There's nothing, all entrance of every new patient should begin with a comprehensive past and present medical history. Secondly, there should be a good neurological workup, and even though all of us chiropractors and all medical doctors have the same license, some with some subspecialties, doesn't mean that we're going to do the job. Some people just aren't as attentive to their patients as they are educated in medical or dental school or chiropractic school. Certainly sometimes a CT scan of the brain or an electroencephalogram of the brain is called for. And speaking of the brain then, where Dr. Jensen is going to address that issue as how the brain is related to sometimes the cause of headaches.
Thank you, Dr. Lala. Well, let's bring up this first slide. And so we're going to learn a little bit of the topography of the brain, find a little bit of the lay of the land. And so when we look at this, we're looking at the brain from the bottom. And right here, what we see here is the brain stem, actually, or the beginning of the spinal cord as it descends through the spinal canal. And from the bottom, you can see that these are the cranial nerves coming off. Right here, you're seeing the pituitary gland, the master gland of the body. You see where the optic nerve crosses over through the brain. It starts, the optic nerve that starts over here crosses over, goes over to this eye. Actually, part of it does, and part of it stays on the same side also. We have the olfactory nerve here, which is your sense of smell. Frontal lobes here, the temporal lobe that takes care of hearing. In the back, you see the cerebellum on this side. On this side, it's cut away, but on this side, that takes care of all your coordination in here. So the coordination of speech, coordination of walking, all those tests that they give you if they stop you on the side of the road and suspect you of drinking has to do with tests that test the coordination of this area. And then with it cut away, you see the occipital part of the brain, which is primarily about vision. And so what we're looking at here is the vasculature that goes into the brain, and it's interesting that the vasculature of the brain is such an important organ that you can see this circle here that's called the circle of Willis, and you have a lot of feeding in of arteries into this area. So if you have a blockage in one of them, the other ones can take over, and you still get blood into each area of the brain, which is very important because you don't want to have a stroke, right? And that's pretty much what that is when you don't have blood going to the brain. Or if you have bleeding out in the brain, that's another type of stroke. Now, we're looking at the lobes of the brain here. You have the frontal lobe here. That's basically where we're making decisions, making plans for our future. Down in this area, it also is those things that your inhibitions are in this area. So a lot of times, say, again, people on alcohol, it inhibits this part of the brain, so people will do more things than what they're used to doing. This precentral gyrus here, that's more for motion. This is more for sensory. The parietal lobe of the brain, when that affects how we relate to the world, feeling as though we're separate from it or unified to it. Occipital area is about vision. And the lateral area here, this is this part for speech. Here is Broca's area of the brain, and the temporal lobe, it deals a lot with hearing. And then here's coordination again, and here's that brain stem that comes down here, going into the spinal cord. So as we look at how we're mapped out on the brain, this is the organization of movement or motor activity and sensory activity. Remember, I told you sensory activity was here, where movement is right in front of that, and our decision to move comes from in here. As well as speech, the coordination of tongue and speech comes from that cerebellum that's not shown here. But then this is recognition of language, so forth there. And as we look how we're mapped out in the brain, you can see how important particular areas or how sensitive particular areas are is by how much space in the brain is taken up by that particular area. So the foot takes up the small area in the brain. Then the remainder of the leg up into the hip, the body, the torso, and we look at just how much is related to our hands. So that's where the dexterity, say a dexterity of a surgeon or a chiropractor, if you will, also is the dexterity of the hands and its movements. And then you have the face down in here with the eyes, the nose, and the mouth. Then as we go over here, this is a sensory part. And again, you're looking, there's less sensory in the foot than there is for mobility of the foot. As we see that mapped out, we have not just the hand, but all this area for each finger is mapped out, takes quite a big area in the brain also. And about the same with the face. So with a sense of touch and so forth on the face is about the same as how much is directed at its movement with all this non-vocal communication with raising your eyebrows and squinching your face and smiling and all that kind of stuff can come from here. So that's how we were mapped out in our brain. Then we look at how the cranial nerves, as they come out from the opening in the bottom of the skull, and just the very top of the cranial nerves, they affect the neck, the head, the eyes, the ears, and the sense organs, the glands, blood vessels of the brain, your immune response, bone growth and fat metabolism, stress, and brain function. So we look at many times if we're looking at a person and trying to judge how to help them, in many cases we can find that an area here that if such as a study that just recently came out with high blood pressure, with looking at the first cervical vertebrae as well as the occiput, and it's disorganization between the two.
And when they had adjustments,
when they had
the blood
adjustment-
pressure went down to normal and off of medication.
Right, and so as we looked at from this slide and its effects with affecting the neck and the head and the eyes and the ears, we're looking at the glands and the blood vessels also. So if you're looking at the glands, you're also looking at the secretion of hormones throughout the body, which has a huge effect. You're looking at your immune system. In fact, one of my sons had a cold recently, and we looked along here, and the muscles that were around it and its disrelationship to each other was way off, and so the adjustment that was made in there helped that cold is well on its way to going away, just because of that effect upon the immune system and helping amp that up to deal with the cold.
And people with who are medical in orientation, in other words, drug-based belief, they believe in drugs and in polluting the body with drugs, couldn't understand that. And what's unfortunate about that is that all of the drug companies are that way, all of the medical schools are that way, and all of the insurance companies are that way too. They don't understand it that way. They think it's a drug or cut and sew or cut out, whereas chiropractic puts nothing into the body and doesn't take anything out. Its attempt is to restore natural, normal function and let the body heal itself through correcting things that are out of alignment in the human frame or in diet.
So basically what we're doing is we're putting body back in the place where it's most capable of handling things on its own.
Right, without drugs or surgery, we're just an instrument.
Right.
Just as much as a dentist or a surgeon is an instrument, but we're doing it on the natural plane.
Right, right. So if we look at that from the nerves go out to every tissue of the body. Every tissue of the body.
Nothing lives without nerve and blood supply.
Right, right. And so if we bring up this next slide, we can see where these nerves are mapped out in the body as they come out from the spinal cord. You have some nerves that they create certain bundles within the body, and we call these plexuses. And so this is the brachial plexus, which goes to the brachial, which is the arm, okay? Biceps brachii, triceps brachii. So we're looking at as the brachial plexus goes down to the arm and feeds that with its nerve structure. And we realize how much of that nerve structure goes down to that as it's mapped out with how much is in the brain that's mapped out to the hand in motion and for sensory. We also find another plexus down here. This is the lumbar plexus, and this is the sacral plexus. And this lumbar plexus actually runs a lot of our genital urinary area. You can affect bowel and bladder changes in there. So many times when we're taking a history, we're asking questions about that as well as the examination.
Right. It could be a low back problem. Doesn't have to be symptomatic.
Right?
That could be causing the headaches, and you say, well, how could that possibly be that if there's some subluxation or bone out of place or curvature in my lower back, how could that be causing headaches? Well, the sacrum down there in the lower back, your pelvis is the foundation of the spine. So as the pelvis goes, so goes the spine. It's much like, so if that pelvis isn't level, then the spine is going to curve, vertebrae are going to go out of alignment, and it is going to adversely affect the pressure within the spinal cord fluid.
Sure.
So anytime a vertebra is out of place or there's a curve in the spine, the pressure within the spinal cord fluid is going to change, and it's going to go up to where, like Dr. Jensen is showing here, up at the atlanto-occipital region, the base of your skull and neck. And the body pain is really a signal. It's the body's innate intelligence telling us, look, something is wrong. Take a look. And so it's fine to look at the head and at the neck, but one wants to look at that entire spine, because many people suffering with chronic headache problems, and they may be going to a massage therapist or a chiropractor or somebody like that, and if they're not looking at them in a whole person perspective, they could truly be missing. There are primary causes and secondary causes, and often they're missing the secondary causes.
Absolutely, absolutely.
And misdiagnosis leads to malpractice.
Right. When I was first a chiropractic patient myself, I suffered from headaches almost daily. And what it amounted to was that I had, back in college, I was in the martial arts and things, and I sprained my ankle terribly back then. And it turned out that the disrelationship of the bones in my ankle and how my foot was reacting would work its way up the spine, and I would have a headache. And when I went to my chiropractor, he said, well, your ankle's up. And I was like, how does my ankle affect my head? And all he did was he adjusted my ankle and let me go after that. And I'm like, what in the world is this? And I still feel my headache. He said, just wait. And 10, 15 minutes later, all of a sudden I noticed my headache was gone. And so I went back in and I said, a few days I had the headache back. I said, you got to adjust my ankle again to get rid of this headache. And he went through and he said, well, your knee is out. And so he'd adjust my knee. And that was it. And again, 15 minutes later, it was gone. It started to teach me how structure from down in the foot and in the knee could affect all the way up to here. And the way that he explained it, which by the way was you, was that when it was unlevel like that, my spine would start to grow off in this direction, and it had to correct itself and pull itself back. And you have ligaments that go all the way across the spine on this side too that would be stretched, and then it has to stretch its way back, and it goes all the way up. And really, when you have all that pressure in the spine going up, it goes to the last joint. And that last joint just happened to be up here, and it took care of it marvelously. I haven't suffered from headaches since.
7 out of every 10 new patients that we see have been to chiropractors and or massage therapists and or physical therapists. Now that includes our medical doctors too. 9 out of every 10 of those people have never been x-rayed, or well, if they have been x-rayed, they have not been adequate scans, or even the Minnesota Department of Health x-ray unit would tell you that chiropractors' x-rays are disproportionately, that's the quote, disproportionately poor quality. And that's an issue that the state is trying to address. And Dr. Jensen and I have been trying to address that in seminars that we teach for continuing education to chiropractors, trying to do the job you were educated to do while you were in chiropractic college. So they weren't x-rayed. Nobody ever looked at their feet to see if there was anything wrong with their feet. Now, as good as technical diagnostic tests have become, they're wonderful, super expensive, far too expensive, too much profit being made in them, to be very honest with you. That's my professional opinion. But there is still structure and function. That God put me together, the knee bone's connected to the thigh bone, everything's connected, everything, if we would just look at the person from a natural, creative perspective. Not talking about religion here now. Start at the feet and work our way up. Use the tests, these inexpensive tests, to determine people's alignment, and then go forward. But no, they're not doing it. They're really not doing it. So, what's next?
Well, next we're looking at, we've looked at how these nerves and bundles has gone on off to the periphery of the body. Now we can look at how these nerves affect the organs of the body. If we bring up this slide, it shows that these organs, all those nerves also go out to the various organs. We look at the heart, and that has 2 innervations, one from up in the head, which is the parasympathetics, which slow down the heart and control the relaxation. If you look over here, you've got the sympathetics that come from the spine. In fact, when you have somebody who has a head injury or something like that, it doesn't allow, that's the regulation that relaxes the muscles. So you'll find people who've had a head injury will be very spastic and very tight in their muscles. Okay, and so there's a regulation between the 2 of those. And in this case, that upper cervical spine, if that's out, then you have a lot of sympathetic or fight or flight that's going on throughout the body. Also, if you see the innervation here, it goes to the stomach. And this next slide here, where we see the stomach, it can affect the stomach. And sometimes we have problems with our gastrointestinal system where the stomach is all in a knot. We might say that we're really nervous or something like that that's going on, that our stomachs, our intestines are in a knot. And it could be due to a subluxation in our back. And the way that I liken that is if I took a string and wrapped it around my finger and held it there, pretty soon that finger would start to change color. It's going to change being able to move it. It's going to change its sense of feeling and so forth. Now imagine that same nerve is going to the stomach. The stomach's not functioning very well. How do we do that? We take the nerve pressure off, and all of a sudden the finger starts to work quite well. So does our stomach. And so just by the change of the nerve flow to it. So if we look at that, there's a problem with a pinching off of a nerve. And doctor, why don't you tell our people out there how that happens?
Well, what you have on your screen there now is illustration of 3.5 vertebra. It's looking at a segment of the spine from a side view. And on the left of your screen, you see A, B, C, D, E, and F. And their lines are pointing to vertebrae. So A is pointing to that blue shape, which is a relatively normal size and shape of a disc. It's then B is pointing to a hole like a window or a tunnel in the spine, and that's referred to as the intervertebral foramina. And through that pass out the nerves, arteries, veins, lymphatics from the spinal cord. So again, everything starts in the brain, passes down through the spinal cord, and then the next one that you see, C, would be an example of just like a nerve passing out from that intervertebral foramina. And then we look down at D, we see that this vertebra has subluxated or gone out of alignment posterior or backwards, which about 80% of vertebrae do. And then under E, we see an illustration of what happens to the disc when the vertebra goes backwards. It wedges it, and that often contributes to what some people refer to as slip disc and spinal stenosis. And then the vertebra below now is in normal alignment. So you can determine some of that through palpation with your hands and range of motion testing, but there is nothing as accurate as adequate spot spinal x-rays to help look at those things. And then based on what we see as doctors of chiropractic, then it tells us exactly what the cause is. Is it treatable from our scope of practice? And some of these issues aren't. There are some people going to chiropractors that shouldn't be going to chiropractors, in my opinion. And it tells us exactly which way to move that vertebra back into proper alignment, as well as what type of exercises to give. And then if we see some nutritional related possibilities, then we would do like a blood test to see what their minerals and their vitamins look like, and do they need any of them. Now, Dr. Jensen is going to bring up a couple more slides that would illustrate. We're looking here at 2 vertebrae that are relatively in normal alignment. We're looking at them from a side projection. At the front, on your left, is the front of the body of the vertebra, and we see a relatively normal size disc there. And then we see up at the top, Dr. Jensen is going to point out where the spinal cord is coming down. And then as he continues to come down, he shows how that nerve, arteries, and veins pass out from those intervertebral foramina. So you see there's plenty of spacing there. The vertebrae are in alignment. That's 2 healthy segments. But now we'll look at another section, and we'll look at it from above, and we see that hole right in the middle, and that's the spinal cord, an illustration of it passing down the spinal cord. And then out to the sides, we see those 2 lateral projections. That would be an illustration of the nerve or artery or vein or lymphatics passing out through there. So when it's in proper alignment, then you're going to have free flow of the nerve energy, which we often refer to as life force, out to the tissues and organs. But then on the other hand now, we see here 2 vertebrae, again looking at them from the rear. And they look in normal juxtaposition. Those bumps in the middle of the vertebra are called spinous processes. Those white things out to the side, those 4 things there, are called transverse processes. And those are primarily attachments for muscles and ligaments and tendons. In the middle, again, we see the spinal cord. Now we're going to look at something that gives us an illustration of a subluxation. So the subluxation, we see here now that up at the top, that vertebra, the spinous process, has shifted way to the right, and it's wedged down on the left side, much like it's wedging down on the disc, on the facets and other tissues involved there. So that would be a classical subluxation of the spine, and the x-ray tells us if it exists and can we treat it and exactly how to realign it. Now, Dr. Jensen, you have another one there for me, or is that it?
No, there we go.
So this illustration, the next illustration is just just an illustration, if you're looking at your screen on the left, we see a vertebra at the top in alignment. The second one, as we move down, has shifted way off to the right. And the third one is shifted way off to the right, and so is the left one. So there are several vertebrae that are subluxated or malaligned there. If we look at the upper two vertebrae or illustrations of them at the top, they're in normal alignment. They're in real good alignment. But when we get down to the middle ones now, the top one has gone backwards, and it's wedging down on the disc, as I said, much like a doorstop, and it would have to be interfering with the normal function of the nerves, arteries, and veins passing out from that intervertebral foramina. Now, the one on the bottom, those two segments, that top vertebra has slipped downward, or what we call anterior-inferior, and it's wedging at the front part of the vertebra rather than the back part as the middle section does. Dr. Jensen is going to, I think he has an x-ray here that he's going to bring up and show you some of these type of curvatures that we typically see.
Sure, and here's what we're seeing is we have an unleveling of the pelvis. Okay, and so the spine is coming straight up from the pelvis there, but it's not straight up, it's going to the side as the pelvis unleveling would have it go straight that way. So now the back has to correct it and bring it back this way. Well, it normally overcorrects, and so we have a second correction, and many times we'll have a third correction. And the reason why these corrections take place is we have a righting reflex. Now let's come back to me here. A righting reflex means that your eyes are righted to the horizon, okay? And if they're righted to the horizon, you see, it's hard to run away from the proverbial tiger when your head is off this way. You tend to fall down. So the idea is a primary reflex is to bring our eyes level with the horizon, helps us keep our balance. So that's where those corrections in the spine take place, from the unleveling from down in the pelvis all the way up to the head. So if we bring back this slide again, you can see where there's wedging that takes place in here. And those can affect those nerves. And you can see the differences in the nerves in that one, we have a wide rib cage here. If you look at each of the ribs here, they're spread apart. If you look at the ribs here, they're pulled together. Now this is going to have an effect of the organs against this area, including the heart, is more compressed in that area, having less room to work, less room to function. Okay? Then also, if you look down here where the nerves are pinched off, and they're, like I talked about the stomach earlier, this one is actually pinching off and affecting how the gastrointestinal works. And so this is the intestines, where we're finding that they're having some problems with their intestinal or bowels in this case.
And that would alter the pressure within the spinal cord fluid, goes right up to the head and neck, and could predispose a person to chronic headache and neck problems.
Absolutely, absolutely. And if we look at another, this is another slide. This is not the same person, and how this is also affecting that. It looks almost perfect to what's going on in that last person. So we have two examples of that now, with two different people that's affected.
What we want to do is just caution you. Certainly, we've been in practice more than a few years, and please don't let a chiropractor, massage therapist, physical therapist work on you without having a good workup neurologically, spinal x-rays, and remember that sometimes headaches are not only due to the issues within the spine, but they can be related to irritable bowel syndrome, to food allergies, and many of the people that we've seen have had reasonably good chiropractic care, but somebody's not looked at their nutrition from a scientific basis. And please, I can't reiterate it strong enough that please don't be using nutrition in a shotgun way. It only sets your health back. It really does. So long life and good health to you. We've enjoyed having you with us.